for any questions that you all may have for me. Let's see one second. So my personal connection to cardiovascular disease is that it is very prevalent within my family. These are my grandparents and myself at my college graduation. And just in general, I mean, my grandfather has suffered multiple heart attacks, and he actually is going in to get some blockage removed pretty soon. And then my grandmother also has cardiovascular problems of her own, including some arrhythmias. So just a little background within cardiovascular diseases, that is kind of this broad term for a lot of different problems with the heart and the blood vessels or arteries. And so just a couple different forms of cardiovascular disease might include coronary artery disease, arrhythmias, congenital heart defects, heart valve disease, heart infection, and I'm sure there's many more. And then symptoms can include, but is not limited to, chest pain, shortness of breath, fatigue, irregular heartbeat, and dizziness. And there are many different ways to diagnose these issues. Some of those might include an electrocardiogram, a Holter monitor, which is like your heart monitor, echocardiograms, stress tests, CT scans, MRIs, cardiac catheterizations, blood tests, and chest x-rays. So how do you treat it? Well, generally they recommend to eat a heart healthy diet, exercise, and then you can also treat it with medications. And I have a couple listed. There's different kinds listed, and then there's many more. And then also procedures, which I do have, you know, the percutaneous cardiac intervention, the coronary artery bypass graft, ablations. So then just diving right in, my first study was a Mediterranean diet lowers blood pressure and improves endothelial function, results from Medley randomized intervention trial. And the purpose of this study was to determine if adhering to the Mediterranean diet for 6 months will improve endothelial function. It was a randomized controlled trial, and it was done in Australia. So the inclusion criteria included those that were 64 years or older, free from cardiovascular disease, no liver, respiratory, gastrointestinal diseases, no diabetes or malignancies within the last 6 months. And then of course, no head trauma, psychiatric disorders, or cognitive impairments. And then the exclusion criteria included those that were younger than 64 years of age and those who had blood pressures that were greater than 160 over 100 millimeters of mercury. So this study was conducted with 6 major clinic visits and then 10 minor clinic visits. The 6 major were taken at baseline, 3 months, and 6 months. And then within those appointments, you had to have your second appointment within the next 7 days to get two appointments within those 3 months for a total of 6. And then the other 10 were sessions with dietitians just to check in on the adherence to that Mediterranean diet. So intake was monitored through a 3-day weighed food record at baseline and then between the major visits. And participants were split into groups based on blood pressure collection and the flow mediated dilation. And so that flow mediated dilation is basically they're looking at their brachial artery. So they like raise their arm and they put a blood pressure cuff on it. And they want to palpate to find that artery. And then from there, they use a transducer so that they can actually record the diameter of that artery. And then these 2 groups were both split into Mediterranean diets. and then habitual diets, which was just following your normal diet pattern. Blood pressure was collected throughout the entire thing for both groups. And so from there, we look at our demographic, and you can see that they are very closely related between age, majority, or about 50-50 on female versus male. The BMIs were very close. And then looking at the systolic and diastolic, or the systolic pressures between the two groups, those were not too far off, as well as the diastolic. And then the flow mediated dilation was fairly close as well. And then that flow mediated dilation at 6 months, you can see that the percentage went up in the Mediterranean diet, where it stayed relatively close to the same with the habitual diet, and there was significant difference between the two groups. And then the systolic blood pressure at 3 months did show decrease in both groups, and at 6 months again in both groups. However, you can see that the Mediterranean diet did have the lower systolic out of the two groups. And then the diastolic is about the same as that. It did show a decrease at 3 months. And I thought it was interesting that the Mediterranean diet was about the same at 6 months versus the habitual diet. However, both did show that they were going in that downward trend. So in conclusion, the Mediterranean diet significantly lowered blood pressure, systolic blood pressure, and improved endothelial function. I gave this study a negative rating just due to I think that the sample size could have been a little bit larger. I'd like to see what it would have been over a longer period of time, but also just the setup in itself. The information that was given, I don't know if you noticed, but the data that was given didn't exactly add. If I go back to that 152, we have 78 and 36, or 136 when they split it. And so I don't know if there was an error there or what was going on. They did not discuss it. So whether they discussed that situation or if they went in and, explained a little bit more, that would be very, very useful. So then my second study was overall dietary variety and adherence to the Mediterranean diet show additive protective effects against coronary heart disease. And the purpose of this study is to determine if dietary variety adds to Mediterraneanness of a diet protecting against coronary heart disease. It was a case control study, and it was done in Italy. So the inclusion criteria was that you had to be between the ages of 30 and 75 years old and living in northern Italy. And so they didn't really list too much for exclusion criteria. So you can also assume that anyone that was outside of those ranges were not included in the study. So how this worked out was that there was 178 coronary heart disease patients, and then 155 healthy case control patients. And they were both given a food frequency questionnaire that they were able to fill out. And then based on that food frequency questionnaire, researchers put it up against the Mediterranean diet score, or an MDS, and which showed adherence to the diet. So the higher that MDS score was, the more adherence there was within the diet. So then looking at the demographics again, age was pretty close. It was mainly males within this study, but BMI was pretty close as well. And then you can see that the Mediterranean diet score was higher in that control group than what it was in that coronary heart disease cases, as well as the overall dietary variety. That control group, once again, had higher scores, and both were significantly higher. So in conclusion, the overall dietary variety has shown to have additive cardiovascular effects. And I also gave this a negative rating since it was that food frequency questionnaire. You know, part of me does wonder if there was any problems with filling it out. Another thing that they mentioned was that while those coronary heart disease patients were included, the healthy control could be family members of those people, as well as like those that like nurses and doctors, those that were working in those settings as well. And I just kind of thought that it'd be nice to look at like the education, maybe include some exercise, and then lastly, just I think it would be interesting to see if we could include more women in the study, and maybe expand the number of people included, as well as like just the general, you know, looking outside of Northern Italy, just to kind of expand on ethnicities and, you know, sex and all those and all other things, just to kind of have a wider variety within that data set. And then also, of course, like looking at it over a longer period of time. The questionnaire was only collected once. So I was, you know, curious to see if there was improvement within that coronary heart disease over a period of time within gaining maybe some education about the topic. And then my third study was randomization to 6-month Mediterranean diet compared with a low-fat diet lead to improvement in dietary inflammatory index scores in patients with coronary heart disease, the OSMED heart trial. And the purpose of this was to determine if a Mediterranean diet resulted in lower dietary inflammatory index scores, or DII score, than that of a low-fat diet. And this was a randomized controlled trial, and it was done in Australia. So the inclusion criteria for this included adults who had coronary heart disease and were able to read and write in English. And they had to have a history of at least one of the following, which could include acute myocardial infarction, angina pectoris with documented coronary artery disease, coronary artery bypass graft, or percutaneous coronary interventions. And then exclusion criteria included malignant tumors, symptomatic chronic heart failure, chronic inflammation disease requiring immunosuppressants or non-steroidal anti-inflammatory medications, CKD stage 3 or above, pregnancy or breastfeeding, allergies to nuts or olive oil, or participation in other study trials. And then for this study, the participants were randomly assigned to either the Mediterranean diet or the low-fat diet. And the appointments that they went to were at their baseline, their 3-month and their 6-month intervention. And then those that weren't able to complete this study, they said were either due to another ongoing health issue within themselves or like a family crisis. So the Mediterranean group was provided a 2-week meal plan, and then they were also given like some recipe books and other educational materials that would help them to adhere to the Mediterranean diet, where the low-fat diet received 1 week of meal ideas and then other educational material as well to help them adhere to their low-fat diet, which even included like tips on how to read food labels and things like that. So once again, the age was fairly close. It looks like we did have more females with the Mediterranean diet group rather than the low-fat diet group. And then there was also more smokers in the Mediterranean diet group. However, the low-fat diet group had higher numbers of the acute myocardial infarction, CABG, and PCIs. So at baseline, both or a DII score was taken, and a DII score is basically looking at that Mediterranean diet that they had been eating, and they look at 45 different nutrients, which indicate high inflammatory, which would be like a positive score, high inflammatory markers. A neutral score would be nothing, and then a negative score actually shows more so of like anti-inflammatory markers. So when looking at data, we're looking for more of a negative number. So at baseline, you can see that the Mediterranean diet already has a little bit lower, but not significantly lower amounts, or I guess higher amounts of anti-inflammatory markers than that of the low-fat diet. But you can see that throughout time, the Mediterranean diet significantly improved in those anti-inflammatory foods versus that of the low-fat diet. So in conclusion, the Mediterranean diet significantly reduced the DII score in comparison to the low-fat diet. And I gave it this neutral rating. Again, I think that if we were able to expand, have a higher participation group in general, and then also just expanding within, more of a 50-50 male to female ratio, those kind of things would help a lot with that. And then also, I thought that the study itself was nicely laid out. It was easy to follow. There wasn't any issues there. I just think that if we could look a little bit further into it and see different populations, again, different ethnicities, that it would be very useful to the dietetics profession. Let's see. So then my overall conclusion is that, we generally recommend, or doctors generally recommend that low sodium diet that is low in trans fat, and the Mediterranean diet definitely does fall within that, between eating more of those fresh fruits and vegetables, lean meats, and then also like some fish to get those healthy heart fats like omega-3s. But I do think that between everything, there's not really one diet that fits all sizes. So I think that it's important that, maybe we could look into other diets as well, because in all reality, we just want to do what is best for our client or our patient. But it definitely is our role to keep up to date on evidence-based research so that we can provide, a patient, a client, or even interdisciplinary teams with the most current up-to-date research, so that we are able to give the patient their best options. So does anyone have any questions? All right. Thank you, guys.
Okay, so before everyone heads out, well, if you have questions, definitely put those in the chat box. I'm just gonna put the link for the whole event in the chat box as well. If you could take just a moment to give us feedback about how it went for you. Maria. Yeah, really good job, Chelsea.
Thank you.
And if you have questions too and you don't want to type it, you can say it out loud as well. But if we don't have any, that's okay.
And I did have my email on the PowerPoint, but I can also throw it in the chat as well in case anybody does want to reach out to me individually with questions.
Awesome. Okay, well, I think that kind of wraps up the whole fall research review conference. So I just wanted to say thank you for everyone for joining and just like bearing with us with the password. We didn't know that was going to happen. So thank you for checking your emails to be able to get into the presentations. It's very much appreciated. Just for being patient as well with us. So yeah, if you can fill out the presentator link and then the whole evaluation link, that would be amazing for us for feedback. But other than that, if you guys are ready to go, I hope that you have a great rest of your weekend. And I hope that you learned something today.
You know if there's going to be a way to watch